This is To the Point with Michael Williams.
Good morning. COVID-19 vaccines will soon be on the way, though for most of us in the general population, it could be on into next summer before we'd have a chance to get them. And they're not coming to Palm Beach County as fast as other COVID hotspots. That's the worry from my guests today, Palm Beach County Commissioners Mack and Melissa McKinlay. Among their concerns, local hospitals, at least for now, not in line for first shipments of vaccines in coming weeks, even though hospitals in Broward and Miami-Dade make that short list.
Well, thanks for having me, Michael. I was very disappointed that the governor's office decided to not include Palm Beach County as one of the 5 hospitals that were chosen. And since we're one of the 3 counties that were hit the most with COVID-19, we believe it's important for us to have one of the hospitals chosen, so in that way we can have vaccine distribution in Palm Beach County.
Commissioner McKinlay, why do you think that is, that we were left off the list, at least thus far?
You know, it's my understanding, Michael, and thanks for having me on with my colleague. It's my understanding that the hospitals were surveyed. And so the hospital selection across the state of Florida was basically made on their self-reporting of what their capabilities were. And, you know, one of the main factors that they said is this ability for cold storage at temperatures at about 80 degrees below zero. And that's how they were chosen. My understanding is that those 5 hospitals in Florida, the vaccines will go to their personnel first. What they have left over, they would then contribute to other area hospitals. And I still have no direction on who's going to make that choice. If the direction is coming from the hospital CEO or if the direction will be coming from the Division of Management. My main concern, in addition to what Commissioner Bernard said, my concern is that it's about to get very political, and it shouldn't be political.
And in fact, Commissioner McKinlay, you were quoted the other day saying vaccine distribution about to get ugly.
Yeah, it is definitely about to get ugly. We've got a draft plan that the state had to draft to meet a federal deadline of November 1st. The document, I'm holding it right here, it still says draft. There's no final document. Our emergency management department here at the county is receiving information piecemeal by piecemeal. I mean, we'll be ready to go. Commissioner Bernard led our effort in terms of setting up testing sites, so our infrastructure will be in place, but we have no clear direction on how this is going to play out.
Commissioner Bernard, any luck in trying to get those answers? Any luck in trying to see if we can get back on or near the top of the list like our neighbors to the south in Broward and Miami-Dade? Where do we stand a few days after you all spoke out forcefully at the commission meeting?
Well, what we've done is we've communicated with the governor's office, so in that way we can find out exactly what's the time frame. And so what we've been told is after the first batch, which is after the first week, then within the second to third week, then there will be a batch that would be distributed to Palm Beach County. We do have in Palm Beach County 4 sites that could have been used that have the capability in Palm Beach County. So we do have the infrastructure in place. So within 2 to 3 weeks, we do hope that we'll have the vaccination in Palm Beach County.
The question is how big a batch, number one, and number two, also concerns, as our friends at the Palm Beach Post pointed out, to the dismay, they said, of commissioners, at-risk elderly who don't live in nursing homes, and first responders are not among the first wave slated to get the coronavirus vaccine. Speak to that concern, speak to how big a batch you'll be getting, and how you decide who gets it.
Well, first of all, we don't know how big the batch will be. The initial phase, which is, it's about 170,000. That's supposed to be 100,000 for the hospitals and then about 70,000 for long-term care facilities. What we do hope is that with the governor's office, that in that first batch, our long-term care facilities will be able to get the vaccinations in Palm Beach County, even though the hospitals didn't receive it. And so we don't know what the second batch will be, but from the county's perspective, our team, which includes the Florida Department of Health, our healthcare district, our county administration, we will put we'll do everything and put everything in place. Whatever the decision that they make, we will be ready to address the needs of our residents.
Commissioner McKinlay, if you were going to grade the state response in terms of how to roll out distribution, how to get this going, I know that you and others have been critical, feeling the governor's not done enough to say, here's our statewide blueprint. Is that a fair analysis of your critique? And what do you need to do to jumpstart that? Some of you said he's been too quiet on this and that we just don't have a good enough idea where we're going yet.
Well, I think I would grade the federal government and the state government probably at about a D right now. I'd give them an A in terms of federal government, an A in terms of developing a vaccine. That's happened pretty quickly. But the lack of direction. You talk about frontline healthcare workers in the state of Florida. We've got, let's see, the number over almost 1.4 million licensed healthcare workers in the state of Florida. So if you're going to talk about, vaccinating in the very first half of phase one, healthcare workers and long-term care facility residents, and then the second part of phase one would be the critical infrastructure workers, where the state has adopted the federal list. That's all your construction workers, transportation, your farm workers. And then in that first half, hopefully we can get our first responders, our firefighters, and our EMTs. The second half of phase one, I'm told, would include our law enforcement officers, and 170,000 vaccines. Divide that by 2 because it takes 2 doses. We're behind the 8 ball in the United States of America on this, and specifically in Florida.
Commissioner McKinlay, and then I'll ask you, Commissioner Bernard, what are the ABCs moving forward from right now? Frustrated now, what are the specific things that you will be demanding, want to see that are absolutes that we'll need to see to give some comfort to Palm Beach County residents and all of those you've described, our first responders, our at-risk residents? In the next few weeks, what are the markers that absolutely must be met, in your opinion, that you'll be pushing to have met? Commissioner McKinlay, you first.
To make sure that our first responders are included in the initial round, those that want to receive the vaccine. Second round, I want to make sure that our farm workers are taken care of. But before you do any of that, we need a clear written plan out of the governor's office on exactly how this is going to roll out, so we can have all of our infrastructure here ready to roll to begin vaccinating residents in Palm Beach County. And to date, we do not have that.
Do you share that critique, Commissioner Bernard, and how much are you turning up the heat to get just that from Tallahassee and the governor's office?
Well, I've communicated with our state representatives and state senators in Florida to make sure that they're communicating to the governor's office to make sure that there is a plan and that they, follow that plan. But since there is a limited number of vaccines that's available, it is very important for our residents to understand that our general population will not receive a vaccination until sometimes in May and June of next year, which means that what we have to do, people right now in Palm Beach County, we're over 70,000 residents in the county have tested positive. We're going to continue to have hospitalizations, and the deaths are continue to go up. So which means that what we need is for our residents to continue to wear their mask, make sure that they maintain their social distance and wash their hands until we're able to get this thing figured out.
And yet we have resistance. We see this national debate about mask wearing, about doing all these things. Does it make you shake your head? What do you say to people who say, I don't want to, it's my constitutional right not to have to wear a mask?
Well, I just think that it's important for us to protect the health and safety of our residents in the county. And yes, they don't want to wear a mask, but they want to impact other residents. And our jobs are to protect our residents. And so we need to wear it.
Commissioner Bernard, and then we'll throw it back over to Commissioner McKinlay. Concern for all of our residents, but there has been particular concern expressed about COVID ravaging minority communities. And with the kind of concerns both of you have expressed, how do you focus that effort for some of our hardest hit minority communities where COVID has proven to be an even bigger scourge perhaps than in the general population?
Well, right now what we're trying to do is make sure that that the vaccination there's access to the vaccination, to make sure that it is free for our residents and for us to be completely prepared to help our residents that's been hit hardest by COVID. And since this is an emergency authorization with the FDA, we need to make sure that we're looking at the impact of the vaccination, so that way we can really provide information to our residents, because so many people are concerned about the vaccine. So that's the reason why we're going to have to do an effort to educate our residents to make sure that the vaccine is safe.
Commissioner Melissa McKinlay, you're living this every day from a public policy perspective. What have I perhaps not touched on? What are keys that you want to leave for our viewers on where we're going, where we need to be going, and how we get there in our remaining time? Commissioner McKinlay.
Well, you know, Michael, I think you bring up a good point when you talk about the virus ravaging minority communities. I think that just shows the much bigger picture our minority communities face. Lack of access to medical care, a lot of uninsured, high rates of obesity, high blood pressure, diabetes, that lack of access to healthy foods, the food deserts. But we need our leadership on the national level to really continue to focus on how we provide good quality health care and get that access, particularly in our rural communities and our minority communities, to every American, so that you don't see these health disparities and viruses like this attacking one community at a much higher rate than another community. It's part of a much bigger conversation we need to be having.
Thank you. And a final 20 seconds, Commissioner Bernard, final thought.
Well, what we do hope is that as we go into the holiday seasons, we want all of our residents to stay safe, stay home, and try to limit the travel, so in that way we can have a safe and happy holidays.
Our guests, Palm Beach County commissioners, but their concerns shared by leadership across our 5 counties and beyond. We'll keep you posted as the debate goes on. Ahead, a soon-to-be former president right down the street. We look at how the political neighborhood in Palm Beach County may be changing in a very big way.